I'm Robin Raskin. I'm here at DigitalHealth Live Studio, and I'm here with Profuse, a company that is doing amazing things, and with Ben Hwang, who's going to tell me about a new way of looking at blood that nobody's really ever done before. So tell me, you just finished a panel and showed what happened using Profuse, what you can start to look at and measure.
Thank you very much for that kind introduction. We are very excited about the technology that we've developed. What we've developed is a technology that allows for us, for the first time, to be able to monitor key biochemistry inside the body in a way that's as easy to get as wearing a smartwatch or putting on a Band-Aid. The data acquisition, or at least the testing, is completely non-invasive. Our sensors inside the body is really, really small, so the placement of that little tiny sensor is no more invasive than what you would experience by getting a little vaccine, or getting a little vial of blood drawn today. And once that is done, that sensor could survive inside the body and work for months and years. And every time you want to take a measurement of that biochemical signal, whether it's lactate or glucose or oxygen or whatever it is that you want to measure, you merely do so in the background via light that's either coming from your smartwatch or from your Band-Aid.
This is incredible. So it used to be, well, we wore a fitness tracker on our arm, and then we saw adhesive bandages that took care of some of our biometrics, but you're telling me you can inject the sensors under my skin and they will stay there.
That's right. And so that's actually the big innovation. We felt that with all of the wonderful innovation in this space that's gone on for the last decade or so, what the industry has not been able to overcome is this incredible form factor that's really easy to use and takes measurement in the background, but do so for information that's actually clinically relevant, where information a physician could actually make a therapeutic or medical decision on. And that's always been the disconnect, right? You can either count steps, which is great, but a physician likely is not going to make a therapeutic choice based on how many steps you've taken before. Or you can measure what your blood sugar level is or what your tissue oxygen level is, but then you have to do so in the clinical setting with large pieces of equipment, or prick your finger every time you actually want to take a measurement. And what we developed is actually the best of both worlds. You could get clinical grade information in real time like you're just wearing a watch.
So the things that you're sensing are?
Yep. So right now, none of the technology has not received regulatory clearance yet, so I want to be clear about that. But that said, we expect to get regulatory clearance in Europe literally sort of imminently now. And that first product is to be able to measure tissue oxygen. So the applications for that is around wound care, wound healing, diabetic foot ulcers, large flap reconstructions, plastic surgeries. When wounds don't heal, it's because tissue is not getting the oxygen, and our sensors will be able to tell the surgeon or physician in real time whether that hypoxia is occurring for that wound. Very next on the list for our product development pipeline is glucose for diabetic and metabolic management, and then others such as lactate, CO2, pH, blood gases. Those are all on the horizon.
So not to be facetious, my doctor doesn't even look at my non-continuous data. I go into the office, he's got his 7 minutes with me. How is this continuous data going to be monitored by your physician?
That's a great question. And I think both our philosophy is, as you generate this wealth of information, do it in the background and not invasively, so that people could adopt. Part of the major adoption stakeholder, if you will, has to be the physician. And for them, we think about it in a couple of ways. One, if you measure certain conditions where real-time information actually matters quite significantly and profoundly in patient outcome, then the doctors will absolutely look at it. They've told us over and over and over again, listen, if you could help me manage and be able to catch restenosis events, for example, in critical limb ischemia patients, and I could bring that patient in before I have to amputate that person, then wow, this is a great outcome, and I will look at it. In cases in which that direct link for a bad outcome vis-a-vis real-time monitoring has not been established, then it's important for us to actually be able to provide either alarms or algorithms in the background.
The delta of change.
Something's
wrong.
Exactly. So that it's time for you to pay attention to this body of data.
Ben, I could talk to you all day about this, and I'm sure people want to know more. So Profuse.com, is that
That's right, Profuse.com. Our website has wealth of information. We are a bunch of folks who are really dedicated to make sure that healthcare for everybody becomes much more painless and much more efficient. And we would love for your audience and people looking at this video to help us along that journey.
We were astounded in your demo, and I think our readers online will be also. Thank you so much for sharing that with us live from Digital Health Summer Summit. I'm Robin Raskin.